If you are over 60 and drink energy drinks every week, or even occasionally just to stay awake, you need to know this. A single can of energy drink can stop your heart. In a Mayo Clinic study, as many as 5% of survivors of cardiac arrest had consumed an energy drink immediately beforehand. No one has warned you about this, but the truth is that this seemingly harmless drink is silently killing the hearts of thousands of older adults every year. So, what is really happening inside your body each time you consume an energy drink? Why does your heart suddenly race, your blood pressure spike, and oxygen fail to reach your heart muscle? And most importantly, how can you recognize the earliest warning signs before it is too late? This video will reveal the truth that energy drink companies never want you to know. If you or your loved ones are over 60, this could be the most important video you ever watch. Before we begin, if you care about heart attack, arrhythmia, heart failure, or any risk that threatens your heart, make sure to subscribe now. This channel provides trusted medical knowledge to help you detect early warning signs, understand the real causes, and prevent dangerous cardiovascular events. Do not wait until your heart speaks up to start paying attention. Energy drinks have become one of the most popular beverages worldwide, favored for the quick boost of alertness they provide. From students and workers to long-haul drivers, anyone can easily purchase and consume these drinks. Yet few people realize that energy drinks are one of the most silent and dangerous contributors to cardiovascular problems, especially in adults over 60. According to the Centers for Disease Control and Prevention, CDC, in 2024 alone, there were more than 20,000 hospital admissions related to heart complications occurring shortly after the use of energy drinks. Alarmingly, nearly 40% of those cases involved older adults. Many assume that energy drinks are nothing more than carbonated beverages with caffeine, similar to coffee or tea. In reality, they are far more complex and hazardous. A single can may contain anywhere from 80 to 300 milligrams of caffeine, depending on the brand. Red Bull contains about 80 milligrams, Monster 160 milligrams, 5-Hour Energy up to 200 milligrams, and some unregulated brands can exceed 300 milligrams in just one can. Once caffeine enters the bloodstream, it immediately stimulates the central nervous system, forcing the heart to beat faster, blood vessels to constrict, and blood pressure to rise. Younger bodies may tolerate this strain to some extent, but in older adults, especially those with underlying heart conditions, this added burden can trigger severe consequences, even sudden death within hours of consumption. Beyond caffeine, energy drinks contain additional compounds such as taurine, guarana, ginseng, and extremely high amounts of sugar. Taurine, a natural amino acid, has been linked in some studies to effects on heart rhythm and electrical activity. Guarana is a plant that carries nearly twice the caffeine of coffee beans, meaning the true caffeine load in these drinks is often hidden under different names. This makes it nearly impossible for consumers, particularly older adults, to accurately gauge how much caffeine they are actually consuming. Sugar adds another layer of danger. A single can of energy drink can contain 27 to 30 grams of sugar, equal to about 7 teaspoons. For people over 60, particularly those with diabetes or prediabetes, this level of sugar not only spikes blood glucose, but also indirectly strains the heart. Persistently high sugar damages the inner lining of blood vessels, accelerates atherosclerosis, and increases the risk of heart attack and stroke. The more serious danger lies in the combined effect of these ingredients. While caffeine accelerates the heartbeat, taurine and guarana add to the electrical stimulation of the heart, and sugar increases inflammation and oxidative stress inside the vessels. All of this happens simultaneously, creating a chemical storm that strikes the heart. The heart is forced into overdrive. Oxygen supply to the heart muscle becomes insufficient, leading to ischemia, arrhythmias, and ultimately a heart attack. In older adults, where arteries are already stiffened and damaged, the consequences arrive faster, hit harder, and are far more difficult to recover from. What makes this even more dangerous is the false sense of energy that energy drinks create. After drinking, people often feel alert and refreshed, as if their body has been recharged. In reality, this feeling comes from overstimulation of the nervous system, not from any true improvement in heart health. At that very moment, the heart is beating faster than normal. Blood pressure has risen above safe levels, and the coronary arteries may already be constricting without the person realizing it. Many heart attacks occur right after consuming an energy drink, yet patients often mistake the early warning signs for simple fatigue or indigestion. A report from the American Heart Association, AHA, warns that drinking just 2 cans of energy drinks within 24 hours can double the risk of arrhythmia in people with existing risk factors. Research also shows that older adults often do not experience the classic chest pain symptoms younger individuals report during a cardiac event. Instead, they may only feel tired, short of breath, dizzy, or mildly nauseous, symptoms that are easily overlooked. This is why energy drinks have earned the name silent killer among older adults. One of the most common misconceptions is believing that if you are used to drinking coffee, then energy drinks must be safe. Coffee contains only caffeine, while energy drinks combine multiple stimulants with added sugar and industrial additives. No health authority recommends energy drinks as safe for older adults. On the contrary, major medical organizations warn that anyone with a history of heart disease, high blood pressure, diabetes, or those taking heart medications should avoid them entirely. So why do so many people continue to drink energy drinks daily and believe they are harmless? What is hiding behind that glossy promise of instant energy? Could the real danger come not from a single substance, but from the toxic synergy of multiple ingredients packed into every can? The next section will reveal exactly what happens inside your body when your heart is exposed to the assault of these drinks. A heart attack, also known as myocardial infarction, occurs when blood flow to part of the heart is suddenly blocked, most often by a blood clot in the coronary arteries. When the heart does not receive enough oxygen and nutrients, heart muscle cells begin to die within minutes. Without timely intervention, the damaged area of the heart may never recover, leading to serious complications or even death. In adults over 60, heart attacks often do not arrive with dramatic warning, but progress quietly, causing victims to dismiss early symptoms until it is too late. The process leading to a heart attack begins with the buildup of atherosclerotic plaque inside the arteries. Over time, cholesterol, fats, calcium, and cellular debris accumulate along the vessel walls. These plaques eventually harden and become unstable. When one ruptures, platelets in the blood rush to seal the site by forming a clot. That clot, however, can grow large enough to completely block the coronary artery, cutting off blood supply to part of the heart muscle. In that instant, the affected area becomes deprived of oxygen and begins to die. A heart attack is not the same as routine chest pain or anxiety. In many people, especially older adults, the symptoms may not be the classic crushing chest pain often shown in younger patients. Instead, they may feel heaviness in the chest, a squeezing sensation, dull pain, or discomfort spreading to the shoulders, arms, neck, jaw, or back. Others may only feel unexplained fatigue, dizziness, nausea, cold sweats, or shortness of breath with exertion. The concern is that older adults frequently lack the typical pain signal, making it easy to mistake a heart attack for indigestion, low blood pressure, or even a mild flu. Time is critical when facing a heart attack. Within the first 60 minutes, without urgent medical care, the damaged heart muscle can expand rapidly, severely impairing the heart's pumping ability. Once a large portion of the heart muscle dies, the organ can no longer sustain vital circulation, leading to acute heart failure, dangerous arrhythmias such as ventricular fibrillation or asystole, and ultimately sudden cardiac arrest. Mortality is highest within the first 2 hours of a heart attack if proper emergency treatment is not received. According to the American Heart Association, AHA, about 805,000 people in the United States suffer a heart attack every year. Roughly 20% of these are silent heart attacks, meaning they do not present with typical symptoms, yet still cause lasting damage to the heart. This is especially dangerous in older adults because after experiencing a silent heart attack, they often remain unaware it ever occurred, making them less likely to adjust their lifestyle or take the necessary medications to prevent another event. Risk factors for heart attack include high blood pressure, high cholesterol, diabetes, smoking, obesity, physical inactivity, unhealthy diet, and chronic stress. There are also unchangeable risks such as age, gender with men at higher risk, and a family history of heart disease. For older adults, the accumulation of multiple risk factors over many years multiplies the chance of a heart attack, especially when not well controlled through medication and lifestyle changes. Treatment for a heart attack must begin as quickly as possible. At the first suspicion, emergency services should be called immediately rather than driving to the hospital. While waiting, the patient should remain seated or lying calmly, stay relaxed, and may take aspirin if there is no allergy to help reduce clot formation. At the hospital, doctors may administer clot-dissolving drugs, place a stent to reopen the blocked artery, or perform coronary artery bypass surgery in severe cases. After emergency care, patients require long-term management with medication, diet, exercise, and strict control of risk factors. Prevention is always more effective than treatment. For older adults, regular checkups to monitor blood pressure, cholesterol, blood sugar, and heart function are critical. Lifestyle changes, such as adopting a heart-healthy diet, quitting smoking, managing stress, and maintaining daily light physical activity significantly reduce risk. Most importantly, avoiding substances that overstimulate the heart, such as energy drinks, hard liquor, and unregulated stimulants, is vital for survival. Many people believe that simply feeling healthy is enough, but with heart attacks, the danger is that they can strike without warning. A person just waking up, resting, walking, or even watching television can suddenly become a victim if conditions align. The heart gives no advance notice. It only explodes when it has reached its limit. This is even more dangerous when small warning signs have been ignored, such as fatigue when climbing stairs, mild chest pressure when lying down, or unexplained rapid heartbeat. Heart attacks do not discriminate. They can happen to anyone, but older adults face greater risk because their cardiovascular system has weakened with age. A heart attack can take a life, but it can also serve as a wake-up call to make changes before it is too late. The key is early awareness, proper prevention, and never dismissing any unusual signal from your heart. So, how can you distinguish a heart attack from other types of chest pain? And what are the clearest warning signs you must remember? The next section will show you the specific symptoms to watch for so you do not miss your chance at survival. Heart attack is one of the leading causes of death in older adults, especially when early warning signs are mistaken for something else or ignored. With the widespread use of energy drinks, many seniors unknowingly put their hearts at serious risk. The concern is that early symptoms of a heart attack triggered by energy drinks can be subtle and very different from the classic signs, requiring accurate recognition for timely intervention. Distinguishing between heart attack, cardiac arrest, and stimulant-related symptoms caused by caffeine or other compounds in energy drinks is critical, particularly for those over 60. Energy drinks often contain caffeine levels far above recommended limits, along with additives such as taurine, guarana, ginseng, and glucose. Together, these act like an electric shock to the heart, increasing heart rate, raising blood pressure, and disturbing electrolyte balance. These physiological changes push the heart into overwork, especially in those with pre-existing conditions, such as cardiovascular disease, hypertension, arrhythmia, or diabetes. The early signs of a heart attack from energy drinks do not always resemble the dramatic chest-clutching scenes seen in movies or textbooks. Many people report feeling palpitations, rapid heartbeat as if racing, unexplained restlessness, or sudden anxiety shortly after drinking an energy drink. Some experience dizziness, blurred vision, or cold sweats even while at rest. These symptoms reflect the heart's struggle to cope with excessive stimulation. As the condition progresses, the person may feel chest tightness, heaviness, or pressure, as if something heavy is pressing down on the chest. In older adults, this can easily be mistaken for indigestion or heartburn. Many dismiss it as bloating after a meal or discomfort from hot weather. In reality, this stage signals the beginning of ischemia, restricted blood flow to the heart muscle, and cells are already in danger. When shortness of breath occurs, with the feeling of not getting enough air, or needing to sit upright to breathe more comfortably, the situation is already critical. At this point, the heart can no longer pump blood effectively to the lungs and other organs, causing fluid buildup in the lungs. Without immediate treatment, this can escalate into acute heart failure, cardiac arrest, or sudden death. It is essential to distinguish between a heart attack and cardiac arrest. A heart attack occurs when blood flow to part of the heart is blocked, usually by plaque rupture or a blood clot, damaging part of the heart muscle and reducing its function. The heart, however, does not necessarily stop beating. Cardiac arrest, by contrast, is when the heart stops beating altogether, blood flow ceases, the brain is deprived of oxygen, and death can occur within minutes without emergency intervention. Notably, energy drinks can act as a trigger for both heart attack and cardiac arrest. In people with pre-existing coronary artery disease, high blood pressure, or rapid heartbeat, energy drinks may cause coronary artery spasms, promote clot formation, or rupture unstable plaques, leading to a heart attack. At the same time, high doses of caffeine and other stimulants can disrupt the heart's electrical system, provoking dangerous arrhythmias such as ventricular fibrillation, atrial fibrillation, or sudden cardiac arrest. Older adults are more vulnerable because their bodies can no longer regulate stress as efficiently as younger people. The cardiovascular system loses elasticity with age, arteries become fragile, the heart weakens, and responses to stimulation are slower. In addition, liver and kidney function decline, slowing the clearance of caffeine and other toxins. As a result, even a single can of energy drink can sharply raise blood pressure, destabilize the heartbeat, and trigger serious circulatory problems. Compounding this risk is the fact that many older adults live with multiple chronic conditions such as hypertension, diabetes, high cholesterol, metabolic disorders, or a history of heart disease. When these factors combine with the strong stimulants in energy drinks, the chance of heart attack, stroke, or cardiac arrest multiplies dramatically. The danger is worsened by the fact that many older adults do not read ingredient labels or underestimate the risks, choosing to consume these drinks simply because they feel more awake or able to keep going. Another concern is that heart attack symptoms in older adults are often atypical and less intense than in younger patients. Instead of severe chest pain, they may only feel fatigue, lightheadedness, emptiness, imbalance, nausea, or unexplained pain in the shoulders or arms. This so-called silent heart attack is particularly dangerous because it is easy to miss until the damage is already done. For this reason, anyone over 60, especially with a history of cardiovascular disease, should completely avoid energy drinks in all forms. Do not assume that just one time, half a can, or once in a while is safe. The aging heart is fragile and highly vulnerable. One small mistake can lead to catastrophic consequences. Recognizing unusual symptoms early and taking action immediately can be the deciding factor in preventing a fatal heart attack. So, if a heart attack does happen, what must be done to survive? What are the correct first aid steps for older adults in an emergency? Continue to the next section to learn how to react quickly and accurately in those critical moments between life and death. Medical evidence has documented multiple cases of heart attacks linked to energy drinks and other high-caffeine beverages, affecting both young and older individuals. A report published on Healthline noted that clinical cases have shown energy drink consumption can trigger serious cardiovascular events, such as severe arrhythmias and heart attacks, although further studies are needed to confirm a direct causal relationship. One striking example, reported by Medical News Today, described a 21-year-old man who developed heart failure after drinking 4 cans of energy drinks every day for 2 years. This case highlights that the risk comes not only from the caffeine content, but also from chronic abuse of synthetic stimulants over time. Other reports have documented episodes of ventricular arrhythmias and even sudden death occurring immediately after young individuals consumed large amounts of energy drinks. Another widely cited case involved a 14-year-old teenager named Anais Fournier who died from severe cardiac arrhythmia triggered by caffeine toxicity after drinking 2 cans of Monster Energy, each containing 240 milligrams of caffeine. She had an underlying congenital heart condition, but this case underscores that in young people, high caffeine intake can still precipitate heart attacks or fatal arrhythmias, even when heart disease is not apparent. Beyond fatal events, specialized research shows that caffeine and other stimulants in energy drinks can raise blood pressure and heart rate, particularly in people who are not regular caffeine consumers. A Healthline update noted that consuming more than 400 milligrams of caffeine per day can increase the risk of cardiovascular disease. Regarding safe limits, both the FDA and Mayo Clinic recommend a maximum daily caffeine intake of 400 milligrams for most healthy adults, equivalent to about 4 cups of brewed coffee or 2 to 3 12-ounce cups of coffee. Pregnant women, however, are advised to limit intake to 200 milligrams per day. The FDA also warns that concentrated forms of caffeine, such as powders, can be toxic at high doses, with just 1 teaspoon equaling more than 28 cups of coffee. However, this guideline applies only to healthy adults without pre-existing heart conditions. In older adults or those with cardiovascular disease, even 1 can of energy drink containing 80 to 200 milligrams of caffeine, especially if consumed multiple times per day, can push intake beyond the safe threshold, place significant strain on the heart, and lead to a sudden heart attack or life-threatening ventricular fibrillation. Mayo Clinic also emphasizes that the effects of caffeine on blood pressure and heart rate vary widely from person to person, and individuals who are sensitive to caffeine or who have pre-existing heart disease need to be especially cautious. One study involving 92 healthy participants found that those who consumed more than 400 milligrams of caffeine per day consistently had significantly higher heart rate and blood pressure compared to the control group. Clinical data and case reports from Mayo Clinic further warn that many energy drinks on the market contain between 100 and 300 milligrams of caffeine per serving. If a person consumes more than 1 can per day, caffeine intake can easily exceed the safe threshold, and when combined with high sugar and other stimulants, the risk of heart failure and coronary events increases substantially. In summary, real-world cases show that even young individuals without underlying health conditions can suffer a heart attack after long-term overuse of energy drinks or heavy consumption in a short period. For older adults, the risk is even greater because the heart is weaker, detoxification functions are reduced, and underlying conditions are often present. The 400 milligram per day guideline is only a general reference. In reality, the safe level should be considerably lower, especially for older adults or those with cardiovascular disease. While energy drinks are often viewed by consumers as ordinary beverages, from a medical perspective, particularly in cardiology, they carry significant risks. According to Mayo Clinic, the stimulants in energy drinks can cause dangerous arrhythmias, especially in individuals with inherited heart disease, and may lead to sudden cardiac arrest. In fact, some patients who experienced cardiac arrest and were later treated at Mayo Clinic had a history of energy drink consumption. Both specialists and patients must understand that energy drinks provide no medical benefit, particularly for a weakened heart. From a regulatory standpoint, the U.S. Food and Drug Administration currently has no specific rules for energy drinks. They are typically classified as foods or dietary supplements depending on how they are marketed, meaning they are not subject to the same rigorous approval process as drugs or medical products. This allows manufacturers to advertise claims such as improves focus or boosts energy, without requiring scientific proof. FDA only requires these products to comply with the generally recognized as safe GRAS standard, but many common ingredients such as taurine, guarana, and ginseng still lack long-term safety data. The FDA has issued warnings about powdered caffeine products, which are even more dangerous than energy drinks because consumers can easily miscalculate doses, leading to rapid overdose and toxicity. Cardiology experts have also stressed that energy drink regulation needs to be strengthened. Physicians at the Children's Hospital of Philadelphia have urged the FDA to bring energy drinks under stricter oversight, similar to food regulation, rather than leaving them in a gray zone as they are now. They have called for clearer labeling, explicit warnings, and restrictions on marketing to vulnerable groups such as children, pregnant women, and individuals with heart disease. Cardiology experts have issued strong warnings about energy drink use, particularly in older adults and those with pre-existing heart conditions. Dr. Alan Gass of WMC Health emphasized that caffeine in energy drinks can raise blood pressure and heart rate, especially when combined with strenuous physical activity or hidden cardiovascular risk factors. He advises that seniors and individuals with heart disease should avoid these drinks altogether. According to Dr. Park, a cardiovascular nutrition specialist, while healthy adults may tolerate up to 400 milligrams of caffeine daily, those with heart disease or advanced age should either avoid it completely or consume only very small amounts. This is especially important since many energy drinks contain 200 to more than 300 milligrams of caffeine in a single can. At Cleveland Clinic, Dr. Marc-Alain Babi further cautioned that the FDA does not strictly regulate energy drinks, and each brand may use varying blends of caffeine, sugar, and other stimulants. These inconsistent formulations can increase heart rate and blood pressure, trigger anxiety and insomnia, and in severe cases lead to a heart attack. In summary, the healthcare system is issuing clear guidance. Energy drinks are not safe beverages, especially for those over 60, those with a history of cardiovascular disease, or those taking heart medications. The FDA has yet to classify and regulate them as tightly as drugs or high-risk food products. Cardiologists stress that energy drinks offer no long-term health benefits and carry numerous potential dangers. Placing energy drinks on a red alert list for older adults is necessary to reduce the risk of heart attacks and sudden cardiac events. If you are an older adult, or if you have a loved one living with heart disease, fatigue, sleepiness, or low energy, should never be a reason to turn to energy drinks. They are a short-term fix filled with risk, and they can cause your heart to collapse at any moment. Your heart does not need a chemical jolt. It needs a steady, nourishing lifestyle that builds strength over time. Instead of relying on caffeine and stimulants, you can safely and scientifically build energy in natural ways. Cardiologists encourage older adults to focus on self-sustained energy through nutrition, proper sleep, light physical activity, and maintaining a stable daily rhythm. First, prioritize sleep. Quality sleep is the foundation of energy restoration in the body. Adults should aim for 7 to 8 hours per night, and this recommendation applies to seniors as well. Avoid disruptions from phones, blue light, or chronic stress. Going to bed and waking up at consistent times, along with morning exposure to natural light, helps regulate melatonin and cortisol production, hormones that control blood pressure, steady the heartbeat, and maintain alertness throughout the day. Second, diet plays a decisive role. Instead of reaching for sugary drinks, choose foods rich in vitamin B6, B12, magnesium, iron, and potassium, nutrients essential for energy production and heart protection. Bananas, nuts, leafy greens, oats, salmon, eggs, and yogurt are simple, accessible foods with powerful natural energy-restoring benefits. Staying hydrated is equally important, as dehydration is a common cause of fatigue, headaches, and extra strain on the heart. Third, regular physical activity is indispensable. Walking 20 to 30 minutes daily, especially in the morning or evening, improves circulation, delivers more oxygen to the cells, and stimulates endorphin release, the body's natural mood booster. People with heart disease should avoid sudden intense exertion, but can safely benefit from slow walks, light yoga, or regular deep breathing exercises to help keep the heartbeat steady. The most important step is keeping your body's natural rhythm stable. Do not eat late at night, do not stay up past bedtime, and avoid coffee or energy drinks after 2 p.m. Do not push yourself with heavy work in the evening. The human body follows a natural day-night cycle, and any disruption directly impacts heart function, blood pressure, and overall health. Maintaining a regular, consistent lifestyle is the most valuable gift you can give your heart. Energy drinks provide no long-term health benefits, and they are especially unsafe for older adults with cardiovascular disease. Anyone who has experienced a heart attack, arrhythmia, or hypertension should avoid these products completely, even a single serving taken for alertness. High doses of caffeine in an aging body do more than speed up the heartbeat. They increase oxidative stress, destabilize the heart's electrical system, and may trigger unpredictable cardiac events. It is critical to recognize that fatigue is not weakness. It is your body's signal that you need rest, a corrected routine, and healthy nourishment. Energy drinks mask this warning, forcing your body to push harder than it can safely handle. It is like making an old engine sprint without checking its parts. The result is overheating, breakdown, and sudden failure. In the end, if you want to live longer and healthier without the constant fear of a heart attack striking at night or on your way to the grocery store, choose to build your energy from within. No pill and no can of energy drink can replace restorative sleep, balanced meals, and a morning walk in the sunlight. Let your heart beat in its natural rhythm, live at its rightful pace, and stay far away from the dangers of artificial caffeine. Because when a heart attack does strike, the cost may not just be your health, it could be your life.